Windshield Survey by Jorge Salmeron. The two communities that I will be addressing today is going to be Stockton, especially the 95202 area, and Turlock, California, 95382. So Stockton's physical appearance is more disorderly, it's dirty, unclean, poorly groomed, unsafe after business hours, and there's high poverty levels. On the other hand, Turlock is more ordinary, sanitary, well-kept, properly funded, safe, and welcoming. General appearance. Stockton presents as an older neighborhood with many areas under construction, empty lots, and abandoned homes. The city has attempted to encourage remodeling and new businesses. However, more work is needed. Parks are not well groomed, and people have a sense of danger, especially after business hours. Turlock, California is more of a farmer college town that has new and remodeled buildings. Most houses are well kept, and the city is well maintained. Despite drought, the city has made changes to update landscape, for example, artificial turf and mulch. Boundaries. As you can see here by the pictures, these are the boundaries for Stockton and also the boundaries for Turlock, which are a little bit more difficult to define. Housing. The houses here in Stockton are definitely older homes. In Stockton, there's about 3,869 units. More than 2,000 of the units were built before 1949. In Turlock, there are 13,496 housing units, and most of them were built, or more than half were built between 1990 and 2008. Signs of decay, pollution, and safety. Obviously, in Stockton, you can see the houses. There's abandoned houses, trash outside, and then at the bottom picture, there's the waterfront. But if you look closely, there's garbage in the water. Compared to Turlock, it's more clean, it's more safe, and there's definitely less pollution. People, the Central Valley in general is very diverse, consisting of whites, Hispanics, African Americans, and Asian cultures. Demographics. So Stockton, California, according to the United States Census Bureau, the population of zip code 95202 is about 6,521. The majority of the population are Hispanics, consisting of 2,483, followed by whites with 2,366. The poverty level in this community is 55.5%. Turlock, California has a population estimated about 36,176. This community mostly consists of whites, consisting of 29,472 individuals, and then the second largest population will be Hispanics with 8,791. The percentage of individuals living below the poverty levels in this community is only 10.9. In Stockton, this community is mostly comprised of Hispanics and whites who are generally dressed in casual clothing. It is important to know that there is a high prevalence of homeless. Throughout California, this community is also mostly comprised of whites, followed by Hispanics. People in this community are well dressed in business casual to casual clothing. It is not rare to see individuals wearing sports clothing, as there are various gyms around the area. Health, lifestyles, and behaviors. Stockton, California, there's a high prevalence of smoking. There's only one large gym, limited outdoor activities, possibly due to safety, high prevalence of illicit drug abuse. Turlock, during my interview, I was only able to see one smoker. There are 4 gyms, people running around the CSU San Jose campus, and also some exercise groups such as cycling and yoga groups were seen. Risk behaviors. Stockton, California has a lot of smoking, illicit drug abuse, alcohol abuse, not following traffic rules such as jaywalking, and large amount of prostitution. In Turlock, there is still a problem of smoking, drug abuse. However, residents in this community tend to have better access to healthcare. Parks and recreations. As you can see here, the Eden Park is not well groomed. The lawn hasn't been cut. It just doesn't have a safe feeling as compared to the one here in Turlock. The one in Turlock is a lot cleaner, more groomed. It just gives you that sense of safety. Transportation. Stock transportation in this community is mostly consisting of private and public vehicles. Some individuals in this community do walk and use bicycles, and those may be due to limited resources. In Turlock, California, most of the transport is private. However, there is public transport that is available. and then just students walk or cycle if they live around that area to go to campus. Health and social services. Stockton, California, the 95202 area does not have any hospitals. It is important to note that outside the 95202 boundaries, there are two major hospitals. This area does have abundance of social services. Turlock, California has access to health care that is more abundant. It includes one hospital, 3 urgent cares, and a lot of doctors and specialists. Social services were not as prevalent in this middle-class community. However, there are services available. Protective services. Stockton contains 2 police departments and also has 1 fire station. The Turlock community also has 2 police departments. However, it has 3 fire departments. Religion. During my window survey, I was able to identify 14 churches in Stockton. This community is very diverse, and it includes religions such as Christian, Catholic, Baptist, Presbyterian, Episcopal, and Seventh-day Adventist. In Turlock, I was able to identify 18 churches. The community appears to have more Christian values. However, the same diversity exists as in Stockton. Education. In Stockton, I was able to identify 8 schools. However, I did not see any high schools or colleges. Compared to Turlock, I did find 11 schools, 2 of them which were high schools, and then 1, of course, was a university. Stores and shops. Both of these communities have various shopping centers and small businesses. In the 95202 area, I was only able to find 1 large chain store. It mostly consists of small businesses that sell products at high prices. The Turlock community has more chain stores, and they include, Walmart, Target, Dick's Sporting Goods. Business and industry. The city of Stockton reports that Stockton is conveniently located in Central California with access to 2 large freeways, Interstate 5 and Highway 99. Stockton also has access to the Union Pacific Railroad, Port of Stockton, and worldwide distribution of products. Turlock is also located in the Central Valley with access to both Interstate 5 and Highway 99. Turlock provides services to California, and if global reach is required, there is access to the Port of Stockton and Port of Oakland. Turlock also provides financing programs to local businesses to stimulate the city and create jobs. Major employers in Stockton are the Human Services Agency, Stockton Police Department, and Stockton Unified School District. For Turlock, major employers would consist of California State University Stanislaus, the Turlock Police Department, Human Services Agency, Foster Farms, and major retailers. Signs of poverty and wealth. Stockton, there's a high crime rate, high homeless rate. It's very unclean, very unkept, and there's lack of, overall health services. Some signs of wealth in the Turlock area. It's more clean. There's more access to both healthcare and community resources, and low crime rates. 4 problems that I identified for these communities based on Healthy People 2020. For Turlock, I identified sleep health, lesbian, gay, bisexual, and transgender health, substance abuse, and environmental health. For Stockton, I identified access to healthcare, environmental health, social determinants of health, and substance abuse. Community resources. In Stockton, I was able to locate Catholic Charities, San Joaquin Department of Aging, Women's Center Youth and Family Services, El Concilio, Women, Infants, Children, also known as WIC, San Joaquin Human Services Agency, Behavioral Health Services, Health Clinics, and Mary Magdalene Community Services. In Turlock, I was able to identify Stanislaus County Community Services, Sierra Vista Child and Family Services, Stanislaus County Behavioral Health, Human Services Agency, and City and University Police. Community strengths. For Stockton, there is a vast amount of community services. There's increased police presence to decrease the overall crime rate, various churches, and various community centers. Turlock has more of a safe community. There's various churches, safe parks and play areas, low poverty levels, and low crime rate. Stakeholders for Stockton, I identified Rita. She explained that the major health problems in this community include drug abuse, mental health issues, and domestic violence. Groups that are at greater risk include children and elderly. Rita suggests that more services should be available to treat mental health and also increase counseling services. Elvira explained that major health concerns in Stockton community include poverty, drug abuse, and lack of health education. Groups at greater risk include individuals living below poverty levels and minorities. Elvira would like to see more programs designed to teach health promotion and education. Two community members that identified were Monica and Sandra. They both agree that this community has a significant drug abuse problem and lack of health services. They would like to see more rehab centers and health promotion programs. Stakeholders for Turlock, Laura explained that the major health problems in this community can be related to the poor air quality and pollution. She explained that overall, there is a problem with obesity, especially in children, and lack of health awareness and education. Groups that are at risk include Hispanic and Hmong communities. Laura would like to see more community services and incentives for better air quality and programs to decrease child obesity. Brian reports that the major health problems in this community include poor healthcare access for minorities, drug abuse, limited resources for our seniors. Groups that are at greater risk include minorities and the elderly. Brian would like to see more community services geared towards health education and also more programs that offer bilingual services. Lucero, another community member, made similar points as Brian. However, she would like to see more services for seniors. Another community member that identified is Gonzalo. He explained that major health concerns include drug abuse and alcohol abuse, especially when driving. He would like to see more substance abuse centers and increase the UI checkpoints. Reflection. Stockton people appear to be more reserved and less trusting to strangers. This can be expected as there is a high crime rate in this area. During my windshield survey, I realized how unsafe areas of Stockton can be. At times, I did not feel comfortable taking pictures or even getting out of my car. Turlock. This neighborhood made me feel more comfortable as people were more friendly. The community is well established and clean and also has a low crime rate. Despite being well established neighborhood, I learned that there is a lack of health awareness and community resources for minority populations. There is plenty of healthcare services. However, there is a need for more proactive efforts for health awareness and education. And these are my references. Thank you.